Great. I'd like to say, first of all, thank you all for taking time, making time to be with us, because we know you're extremely busy. And secondly, that Jennifer and I are both prevention consultants certified by the state and have been for many years. And we really value prevention and how it impacts our youth. And we're grateful that you're interested in the services.
Yes. And we'll go to the next slide. There we go. So we're with the Recovery Center. So a lot of people know us as a treatment agency, which we absolutely are and have been for almost 50 years and under different names. But we also, in the past 30 years at least, have been doing prevention. And of course, education and support for people who might need some help with loved ones, families, that kind of thing. Next slide, please. We know that effective prevention saves lives and saves dollars. And that is one reason why Trisha and I are both dedicated to it, why our staff is very dedicated to it, because the people we have on staff have been doing prevention for, oh my goodness, at least 10 years, or for a vast majority of their professional careers. Next slide. There we go. We know that every dollar invested in school-based prevention saves money. It saves up to $18 in costs related to substance use disorders, incarceration, all those things that we think of when we think of substance use disorder. Next page. We know that they work, that 80% of U.S. youth participate in school-based prevention programs, but only 20% of these are evidence-based or effective programs. Next slide. Next slide. We do have our staff all are dually certified or dually licensed as social workers or professional or counselors, and as prevention specialists. Next slide.
So today we want to focus on ADAM board funded programs. So we're very grateful to the ADAM board for believing in prevention and how important it is. The first program that we wanted to talk about is our Botman Life Skills Training. This program is evidence-based. It's been around forever. And we want to mention that most of the programs that we're talking about, whether they say they're drug prevention or life skills, they all work together. Really, they're helping our youth be more resilient and healthy, and they all have some of the components of the other programs to them. So life skills focuses on life skills, and in doing so, you're also helping prevent substance use problems and other kinds of problems that youth may face because they're learning how to manage their life more effectively. The Botman Life Skills program is for grades 6 through 12. It's typically more so done at the middle school level rather than the upper high school grades, and the focus is actual life skills. It's done in the classroom with the whole class, and we typically like to do 10 weekly sessions, and depending on a school, like your format, if it's a 9-week opportunity that we have, then as our prevention specialists are qualified to do, they can do it in 9 weeks, so we can condense it a little bit. Next slide. So this program promotes health, well-being, and personal development for each individual. It addresses the most important factors that lead to problematic behaviors, such as providing health information, general life skills, and drug resistance skills, all encompassed in one program. Next. Catch My Breath is a program that we've always done tobacco education. Catch My Breath is specifically a program that we're doing this year because it is evidence-based. I guess the positive side and the downside is that it does focus on nicotine vaping and e-cigarettes. Typically in the past, we have talked about all types of tobacco, and we can add a little bit about other types of forms of tobacco if necessary, but most of teens and youth are using nicotine vaping and e-cigarettes, and that's why this program is really relevant to today's time. And the format is in classroom instruction, and it is 4 weekly sessions. And it's done in grades 5 through 12. It equips the students to make informed decisions around the e-cigarettes, the different types of them, and it's the only evidence-based nicotine program that there is. Next slide. Okay, the CAST are you talking about that or what?
Right.
Okay, the CAST is coping and support training. It's for grades 9 through 12. The focus is life skills and social support. And this is typically done in more of a smaller group discussion for specific youth. And it is 12 lessons. It's twice a week. Yeah, twice a week is what we like to do that program. Do you have anything to add about that one?
No, so it comes from Reconnecting Youth, which is also evidence-based, and another program that we will be talking about at the end here.
Okay, next slide. It's more for higher risk youth who have some things going on in their life. They might have varied issues related to mood management, school performance, and it's decreased drug involvement. It's to focus on their self-esteem and help them with monitoring their goals. So we talk to them about, what do you want your life to be like, and how can we get you connected and focused on moving in that direction? And then we also focus a lot on decision making here, making healthy decisions that are really going to help you to achieve your goals, as well as personal control. So not just making a decision on the spur of the moment, but what's best for you in the long run. Next, that's a program that we're really excited about and think that it will bring some new light to our youth. Okay, the next one is Incredible Years. This is for our younger students in grades pre-K through third grade. And the focus here is on social emotional learning aspects. And it's done in the classroom. And we like to do 12 weekly sessions, but again, if we need to do it in 9 or 10, we can make those adjustments and focus with the teacher on what are the most important parts for the youth that we're working with. Next. Social emotional learning, and again, it's self-awareness, social awareness, building relationship skills, making responsible decisions, and there's an academic competence skill set. Next. Project Alert has been around for a long time, and it's a really good program. It's geared towards 6th through 10th grade. Mostly we've done it in 6th through 9th grade, and the focus is on alcohol and other drug use and peer pressure. Again, though, making healthy decisions and thinking about the potential consequences. It's very activity-based, and it's done in the format of classroom instruction. I've taught this program before, and I really love it. The students really get into the different role playing that they get to do to practice their resistance skills, and it really helps them think from their perspective. So it's a great program. Lessons is typically 10 weekly sessions, but again, it can be done in a 9-week session. And again, very interactive and really allows them to think about on their own what the potential outcomes might be for them if they make an unhealthy decision and what's really best for them. Next slide. So I think we already covered that. It's highly interactive, a lot of brainstorming, and it increases knowledge in the dangers of alcohol, tobacco, and any type of drug use, and learn how to really confidently handle and avoid peer pressure. What would I do if I was in a situation? Because we know that nearly every youth is going to be faced with that challenge before they graduate from high school. So having a plan in place ahead of time greatly can prevent the likelihood of them actually using drugs. Next slide. Reconnecting Youth. This is for grades 9 through 12, and the focus is here on high-risk youth. So youth who have been a little bit disengaged from school, perhaps they're not performing well, or they're missing school. We know that they may be having some substance use going on in their life or some family issues at home. The format is generally a small group discussion, and it's typically 16 weekly sessions. We like to do a whole semester if possible. And I know from having facilitated Reconnecting Youth that it's a great opportunity for youth to come in, and immediately they start talking about the challenges that they're facing that day or that week, or who's upset them or what's going on. And we can really hone in and bring them into how that affects their life and the decisions that they're making, and getting them re-engaged. And again, what's best for them and their future. So it's really helpful with coping skills, but there are different weekly lessons that we focus on every time that help them really look at their life and what they want to get out of it. Next slide, please. And the topics listed here are goal setting, decision making, self-esteem, and coping skills. Thank you. Next slide.
And to tag on to what Trisha was just saying, we have Reconnecting Youth Expanded. This has been, this program is geared towards 6th through 12th grade, focuses on support and positive peer interaction. It is an after-school small group discussion intended to be at the school or in one of our community partners, if we can work through that. The lessons are varied. It could be up to a full school year, depending upon what we can work with any given district. Next slide. This program is a pandemic response from the ADAM board. It is only going to be for this year, and it is in addition to the allocation that you've already received. So it wouldn't come out of whatever your allocation is for your given district. And this is, as I said, the pandemic response. So we know that 25% of young adults surveyed in the months following when the pandemic began 2 years ago, that 25% of them had contemplated suicide. We know that the U.S. Surgeon General actually sent out the advisory on youth mental health crisis just about 2 months ago, saying that COVID has had a devastating impact on the mental health of America's youth, that we've seen increased feelings of loneliness, futility, and low self-esteem, potential for negative messaging and bullying. We know that even before that, we had kids who were dealing with persistent feelings of sadness and hopelessness. 1/3 of our youth, it had increased by 40%, which is huge. So we know that there was already some mental health crises going on, and that COVID has only added to that. So this program, next slide, please. So this program would be the Reconnecting Youth that Trisha just talked about, and adapted for our times now, and done in an after-school setting. Would not come from your allocations. It helps struggling youth. It doesn't necessarily have to be high-risk youth, so it doesn't necessarily have to be someone who comes from a home with a lot of issues or whatever. It could be just someone who happens to be struggling with whatever the situation might be. It is available only on a limited basis, and only just to a few schools. It is therapeutic and activities-based social emotional learning, and supposed to be a good way for kids to kind of get together and have something to do after school, and deal with some of the stuff that we are currently, that all adults are dealing with, but kids are even more so. Next slide.
So they might be able to do some kind of a campaign if their school allows them, when we're working with them in this program, so that they can raise awareness throughout their school, which is really neat too. Yeah, it's very we can adapt it a lot, which is going to be pretty neat. Next slide is red flags. This is initially was just a depression awareness program. It is now mental health education, and that came out of the Sandy Hook disaster. They decided that, you know what, we needed to really work on mental health in general and not just depression. And this is geared towards 6th through 8th grade. It is classroom instruction, and it would be 4 weekly sessions. Next slide. The goal is to get it before, and that's why it's a little bit younger, to get people educated, to get those kids educated before there is an onset of concerns. It is personal growth. We talk a little bit about stigma and words and phrases, resiliency, signs and self and others, and what to do if they need to seek help, or if someone else they know needs to seek help, or to seek help for another person. And if we can add, there is a component where we can come in and talk with his school staff as well and do it what signs and symptoms to look for.
Next slide. Yeah. Safe dates has been a really, I think, a well-received one, unfortunately, in these days again. This goes through grade 8 through 12. The focus is on healthy dating and what that is, healthy relationships and what that is. The format is a classroom instruction, and it is about 4 weekly sessions. It can be adapted down to about 3, but not much less than that. Next slide. Naturally, it focuses on safe dates. What is safe? What is unsafe? Helps with one's self-esteem, self-actualization, confidence, and prevents the many forms of dating violence. And talking about, the continuum and how things transpire. Next slide. Too Good for Drugs is also one that we've done in K through 12. It is just a general alcohol and other drug prevention program. It is, of course, classroom instruction, and it is 9 weekly sessions. Next slide. It's your basic information about alcohol and other drugs, of course, done in a preventative style. We do not do some of the things that we might have seen many, many years ago, or that we saw that we didn't do, but we saw done. It is, of course, evidence-based, goal setting, decision-making, communication, peer pressure skills. Focus is pretty much purely on not using drugs and drug and substance use prevention. Next slide. And then related to that, we have Too Good for Violence, the same people, same focus group. This one is violence prevention. Excuse me, it is a 9-week session. Next slide. And naturally, it focuses on violence, bullying, which, when you're young is a form of violence, anger resolution or conflict resolution, anger management, bullying awareness, communication, responding peacefully, what to do, kind of character education, some things to look for, what to do if there's a problem, that kind of thing. Next slide.
Okay, additional programs. Next slide. So we have some other programs that are not funded through the Adam Board, but we do offer them, and we just wanted to make a quick mention. Cyber Smart is one, and it is a few different lessons where we come in and talk about how to be safe on the internet. It's not evidence-based yet because it hasn't been around long enough to have enough research done, but the schools who have had it in the past have really appreciated it. We also can provide parent education and staff training on different topics such as mental health, addiction, signs of depression and suicide. And then we really like to celebrate Red Ribbon Prevention Week, and we can work with your school to give your staff ideas for campaigns. We often provide red ribbons for students. So any way that we can work with you to help make that a success, we're happy to do so. Jennifer does a great job with that. And she actually can send out ideas to you of things that you can do to celebrate Red Ribbon. And if you're not familiar with it, you probably are, but it is a drug prevention awareness week to celebrate with the youth on that. And then the youth intervention program, some of you participate in this already, having youth who have had a violation at school. Maybe they're unable to play sports until they get some education. It's a one-time class, intervention class, where they come if they have used alcohol or some other substance. They come and talk with our staff and receive education about making healthier decisions and consequences and all of that. So that's offered monthly, and it can be more often, or if you would happen to have a group of youth at your school who would have some type of violation, sometimes we have gone to the school and provided that as well. Next slide, please. And then we also offer counseling services. Next slide. So we work with all ages of youth, really from 3 and 4-year-old, typically somebody who has a parent who's in treatment, but we can work with any age youth, and we work with them on mental health and substance use problems. So a lot of people think that we're just a drug and alcohol only agency, but we are nationally accredited for mental health, and we're seeing more and more people for mental health issues. this current year, we started piloting counseling in the schools, and we're very excited about that. It wasn't without some glitches, and I have to apologize to JB at Amanda because he has waited patiently for most of the school year for a counselor. Our field is having a tremendous shortage, and to work in the schools, we want the right person with the right skill set. So we're finally starting in Amanda, and we've provided some services in Lancaster City that have gone very well there. So you can move to the next slide. But we're grateful to be doing that. We're interested in providing the service for more of you if you would like us to come to the school. And I think we've worked out some of our little glitches and bugs of how to do that most effectively. So staff in cooperation with other agencies, sometimes we refer the youth to another agency, but we do work with a comprehensive range of behavioral health care issues and services. And we work with the school, ensure that the services are being provided and that there's good communication. And typically in the past, we've done this at the Recovery Center. We can still do that, but again, we might be able to provide some of those services at your school as well. Next slide, please. And of course, we adhere to all of the federal confidentiality laws, which are very strict. But when we are able to share the necessary information, we do so. And if we can't, it's because the family hasn't given us consent to do so. Treatment recommendations are made after a youth has an assessment done where we look at the whole picture of what's going on with their life, and then we come to a decision of what would be most beneficial for them. And they are provided regardless of a person's ability to pay. Next slide. And here's just a list of our other agency services that we do. I think we've talked about most of them already, but we wanted to give you a snapshot of that. And are there any more slides? Okay. And in conclusion, I would just like to add, it's been a super challenging year. I can't even imagine being in all of your shoes. We have experienced some of the similar challenges ourselves with workforce issues. And I know at the state level, there's a lot of discussion about the crisis that the behavioral health field is in because of the lack of sufficient workforce to be able to provide the services that we're providing. So we just want you to be aware of that. And I think for the Recovery Center, we were challenged this year with changing. Now there are a lot of agencies providing services, and we're looking at how can we do better this coming year. And we welcome your feedback on that. I think in some cases, providing a staff person at a school, for more directly to be there certain days of the week, or we're open to looking at things. We also did experience a couple significant illnesses this year with our staff, which we are sorry for, but COVID's been very challenging for our staff as well and their family members. So we had a significant illness there, and we're being very careful of school protocols. So thank you for working with us. And again, we're very committed to prevention. We highly value you and what you're doing, as well as offering these services to your youth. So we'd be happy to talk with you more in depth about any of these problems right now to answer any of your questions.
Next slide. Okay, so any questions? We still have just a few more minutes left.
Right, and I would say if you have a question, just unmute yourself and go ahead and ask.
We definitely see some familiar faces out there, so people might already have a good grasp of what we offer.
Please feel free to contact us, though, with any questions that you have, and we'll be happy to answer them. We look forward to working with you all.